Because in reality, septal cells are all over. But that's where they put them. And then I think here they're just trying to show pores. These little black dots here. More sacs on the backside. More pulmonary capillaries. Septa on the sides. And lots of systemic vessels. These are systemic capillaries. Here you can see the bronchial artery and vein. You can see some of the branches. So like this network of veins, that's a venous plexus, that's systemic. All of these branches, all the blue and red in here, that's all systemic. Remember, pulmonary are much larger than the systemic are. A very, very small fraction of systemic blood flow passes through the lungs, whereas the entire blood supply of the pulmonary circuit goes through the lungs. Some things that shouldn't be here: the blue is cartilage. There's no cartilage this far down. The green is mucus. There's no mucus this far down. Everything else is okay. They got the smooth muscle there. And then they get really magnified on the back side here. Cross-section through the capillary wall. Fibers, elastic fibers here. The star-shaped cells, macrophages. In the septa, you can see the cross-section of some nuclei. Those are septal cells, or type 2 alveolar cells. And then all the cells that just collectively form the wall, those are all type 1. So together they form the alveolar epithelium, all those type 1 cells. So here's one alveolus on the back side. This kidney model, here they're taking gross anatomy, superimposing a little microscopic anatomy. You could not see, with this level of detail, collecting ducts, loops, convoluted tubules, glomeruli, not without a microscope. But they just wanted to give us more bang for our buck, so they superimposed some microscopic anatomy on the gross anatomy. Capillaries out here, paratubular, capillaries in here, vasa recta. What you would be able to see with the naked eye is the striations. You just wouldn't see the actual tubules forming those striations, not that clearly. This is good for blood supply though. So from renal artery all the way back to renal vein, because it even shows efferent and afferent arterioles, it shows capillaries, so really everything. Here, higher magnification. They're separating all the blood on this side from all the tubules on this side. So on the blood side, what's the little round thing?
The
glomerulus. And on the tubule side?
Bowman's capsule.
Bowman's capsule. So when you put the glomerulus inside of Bowman's capsule, you get this.
The renal corpuscle.
A renal corpuscle. Along with the renal corpuscle, so glomerulus inside, capsule outside, you've got afferent arteriole, efferent arteriole, DCT. You can actually see the macula densa cells. They communicate with the JG cells and the afferent arteriole. So here's your JG apparatus. Little PCT there. Back to this one. So if you start at the Bowman's capsule, what's the green here?
That is the PCT.
PCT. If you start at the collecting duct and go backwards, what's this one?
The DCT.
And then you can follow the DCT down into the ascending limb. Then you can come up the descending limb into the PCT all the way back to Bowman's capsule. That is how you figure out if you're looking at PCT or DCT. You either start at the corpuscle or the collecting duct. So on this one, like this one, any capillaries shown above the arcuates, paratubular. And then any capillaries shown below, vasa recta. So if you start with collecting duct and then work your way into the nephron going backwards, that means the purple is?
The DCT.
And then you can go forward if you want. You can start at the renal corpuscle And then the first one is this like salmon colored one,
It's
peach colored
PCT.
one. That's PCT. And you can follow it down into the descending limb. Then you can come up the ascending limb, which becomes DCT, the purple one again. Goes all the way into the collecting duct, cortical collecting duct up here. As soon as you hit arcuates, now you're getting down into the medullary collecting duct. Long loop of Henle. So this is a juxtamedullary nephron. Short loop of Henle. This one's so short it's actually not even going into the medulla. Cortical nephron. Efferent arteriole, afferent arteriole, corpuscle. This efferent arteriole is going into a paratubular capillary, which then empties into the cortical radiate vein, which goes to arcuate vein, and then from there to interlobar, which we can't see on here. We can only see from arcuate on down to the smaller branches. Vasa recta, all the blood vessels down here, connecting pieces between. So we have 1, 2, 3, 4, 5 collecting ducts that all converge onto one
Papillary duct.
papillary duct. I think that's about it. All right. One last one. What's the smallest airway shown on this model?
Tertiary.
Tertiary, the colored ones. So this is a secondary, and this is a primary, and this is trachea, and this is larynx. And then for the larynx, the laryngeal cartilages, the 3 big ones, cricoid, thyroid, epiglottis. You can look at a sagittal view if you want to see vestibular fold and vocal fold. You could even put it together and look through it and see that it has an open glottis because there's a space in there. So I can put the stick through the glottis there. Trachealis muscle, right, the soft tissue in the back. Okay, all yours.